Welcome everybody to the university, and thank you very much for taking time out of your busy schedules to be here. I'm sure you could have been lots of other places, especially on a day as beautiful as today. Maybe I should thank Mother Nature for having the big storm last week, I suppose, too. So as Kim mentioned, I oversee the clinic administration here at the university, and I get to work with Chad and his team on a regular basis, and certainly enjoy all the work that's being done in Worksite Right. So it's certainly my privilege to welcome Chad Hendrickson, Dr. Chad Hendrickson, to the conversation here. He's your speaker today. He actually is a graduate of Northwestern. He's a chiropractor and has spent the last 20 years delivering on-site wellness programs to employers and employees across the country. Chad and his team today with Worksite Right build customized on-site solutions for helping to deliver employee health and helping your company meet their needs. So please join me in welcoming Dr. Chad Hendrickson.
Thanks. This is a bit of a role reversal. As Mike mentioned, I'm a graduate of Northwestern, and I've spent plenty of hours on that side of this room and others as well like it. And I'm really fortunate to be in a position that I get an opportunity to do what I love, and that is to try to help people improve their lives, improve their health, and in the process, I get to help employers be problem solvers in that solution. As Mike mentioned, for the better part of 25 years, I've been involved in employee health. I didn't have a traditional path in my chiropractic journey. After graduating from here, I soon started contracting with individuals like you and providing employee health and wellness services, some of which we'll touch base on here today, and particularly the idea of on-site chiropractic or on-site care. And I did that in a private practice setting for the better part of 15, 18 years until I was asked to come back and head up a new initiative here at Northwestern. And it's really exciting because I get a chance to come back and work with a great group of people and really try to truly make a difference in the healthcare world. Certainly in how we deliver it or how we engage employees or patients in that process. One of the very frustrating aspects of healthcare, and there's lots of frustrating aspects of healthcare for a lot of people, but certainly as a provider, one of the really big challenges is being able to see patients when it's most beneficial for them to receive care. Because unfortunately in our healthcare system, we really function on a crisis mode. Right? When it gets bad enough to change my life, then I'll go in and address it, and oftentimes we don't do that, and that pushes people into our emergency rooms and critical care and all of these things that are tremendously costly. And with employers paying, I think, roughly between 60 or 65% of all healthcare bills, it's become a pretty dramatic concern for just about all employers of all sizes is how do I have healthy workers? How do I support them in their health habits? And how can we as a company benefit from attracting and retaining health-minded employees? And so as a healthcare provider, like I said, the challenge is that you wait for them to come in and engage you in healthcare, and oftentimes, as I said, it's crisis. What we're going to talk about today is a little bit more proactive and the role that employers can play in that process, no matter how big you are, right? I mean, if you're an employer that has 5 employees or 500 or 5,000, what is it that you can do to support the health and well-being of your employees? Because I think we can all agree that a happy, healthy employee is a productive employee that we would like to be able to retain for an extended period of time. And so we'll go through a handful of things in regards to that, but I wanted to start off here by talking just a little bit about, how does an employee's health affect you? Because we oftentimes think that it's about the healthcare dollars. Who in here, whose employer provides healthcare benefits to their employees? Right? As a company, do you provide healthcare benefits? Right? So we're always worried about the cost of that, right? And we're always waiting for our new premium, or if we're self-funded, what is the cost outlay for that process? And the healthcare costs are continuing to rise and have done so for many years, if not decades, right? And that's become a growing concern of employers. When I started in this and I was trying to talk to employers about improving their health, they weren't even that interested because they just had somebody in human resource go find a policy, and they didn't care. And it was 100% coverage, and everybody was happy, and it was affordable, and it was never on the radar screen. That landscape has changed, as you guys know. Now healthcare is a top decision-making level amongst C-level suites, and there's a lot of time, attention, and focus put into how can we provide the best benefit structure to our employees. Number one, to reduce costs. Number two, to have that healthy, productive employee stay with us. But I think it's a lot more than just healthcare costs that health affect. As a matter of fact, the employers that we deal with, oftentimes that's number 2 or 3 on their list. With the job market in today's world, sometimes it's about retaining and attracting the right talent. Right? Unemployment rates are extremely low, and the new hire pool out there isn't filled with a lot of highly skilled, highly talented people. And so, how do you not lose your good people to begin with? And then how do you attract people with this mindset and that can meet your company goals? And so I think attracting and retaining employees, of which services like healthcare benefits can do. As you'll hear me talk a little bit about later today, the main core of what we do is we provide on-site chiropractic care right within the workforce. And that's great for employees, and our data shows it's great for the employer as well. And what that does is that allows companies to be able to go out and market that to the employee pool out there and say, hey, you know what, we have a great benefit program, and you can have access to health care right at work during company time. And a recruitment tool is very valuable for a number of our accounts. Absenteeism continues to play a big role for companies. I was on site at a company last week in Virginia, one of our accounts, and they currently have an 18% absentee rate each day. They're a manufacturing facility, and for them, that's a number that is really trouble, right? Because now they're shifting people, and they know that the employees know that they can call in and be sick, and it doesn't matter because they can't go hire enough new people anyway. So their firing process is pretty lax, right? They're trying to keep people around. That creates a business problem for us, right? If somebody has a major healthcare issue and they're out for an extended period of time, how do you cover that person? What resources have you lost because of that? And what could we have done in a more proactive way to be able to make sure we're not having our employees miss work? Work comp claims are also another really big concern for a lot of companies. One work comp claim can cost a significant amount of money. We did an assessment for a company not long ago that had a claim over $1 million, right? You want to change your business model as a small employer, a company of about, this facility was about 260 employees, and they just had $1 million claim, right? And so that changes the landscape of their work comp system for an extended period of time. Let alone the fact that somebody got hurt enough that it cost $1 million for health care, right? There's a person behind that as well. And how does that affect them and their family and the people around them as well? So I think that health care and the employer's role in it has a big effect in what we can be able to do. The next question for us should be, as an employer, what considerations should we have in investing? Is there anybody in here that does nothing along the line of employee wellness? They're doing nothing. This is indicative of what we see. Everybody does something, right? Some people, they've got a stop smoking program, or maybe they have an EAP program, or maybe they've got a wellness committee, or maybe they do 5K runs or a weight loss program. Some do more than that. And so they're always evaluating how much can we invest in our employee health and wellness programs, and oftentimes the financial decision makers are taking a look at, well, what's my return on investment going to be? And that should be a key aspect of the consideration. Sometimes companies invest $25,000 in a wellness program and get nothing out of it, and they're out $25,000. Some companies invest $250,000 in their health and wellness program, and they're able to show a return on investment of $500,000. Which company do you want to be, right? You want to save the $500,000, not spend the $25,000. And so what's the return on investment and the time that's involved in that? What risks do you have as an employer by trying to push people into this, right? Healthcare is a very personal issue for a lot of people, and they don't like to share all their healthcare information with their employer, right? They're very skeptical of that. And so how can we make sure that we've got services that we can put in place that respect people's privacy but yet motivate them to be a better person and to take action and to take responsibility for their own healthcare? Or how do we engage employees? I think that this is one of the biggest things that we're talking about in wellness circles today is how do we engage employees. So telemedicine is a new fad, right? I mean, everybody's getting into the telemedicine, and that's great, and it provides great opportunity and access and all. Do you know what the national engagement in telemedicine rate is right now? Does anybody have a guess? 2%? Yeah, that's pretty close. I see it as high as 4% or 5%, right? So 5% of your employees are engaging in this new great service. And I'm here to tell you that I think that those 5% are probably the 5% who are going to engage some other way anyways. You're not getting to the people who are not engaged already somewhere else. And maybe over time that changes, right? I mean, we hope that that's the case and those numbers go up. But what are you doing to drive engagement across, I don't care if it's a weight loss program, if you've got 27% of your employees that are tobacco users, what are you doing to get it down and drive those 27% or whatever the number is into your tobacco cessation programs? That is a really big aspect, and a lot of that has to do with messaging. And there's no shortage of vendors that will come up just like I'm doing here today and going to throw a bunch of services in front of you and talk about all these wonderful ideas and concepts and all of those things. But the question that you should be asking when you're looking to invest in employee health is am I going to be able to get my employees to engage in that service so that there can be a change? Because if you can't engage the employees, how is there ever going to be change, right? What you're going to have is you're going to have a really frustrated management team that is trying to do everything for the employees. They're not taking advantage of it, and then they quit, and it's all done, and it was wasted money, and now you're out your $25,000 and didn't get a chance to have that return on investment. We see it happen far too often. The other thing that I think that's really important to consider in this process are the people that are at your company, right? Too oftentimes we take a look at health and wellness vendors and we think, well, that worked really great over there. That must be that's what we want to do, right? Or we have somebody that refers us to somebody else and it worked great at their place, and now we don't know why it didn't work at our place. And I think that if you're going to drive engagement, if you're going to be successful, if you're going to have a return on investment, what you need to do is you need to take an internal look at where you currently stand. Is there anybody in this room that does biometric measurements on their employees, right? Blood pressures, glucose levels, those types of things, right? To see how healthy they are. How about some sort of health screening, right? Those types of things. Those are things that we should be doing before we ever invest in a vendor service, right? We should know what's going on with our employees so that we can customize our services or our opportunities to employers to make sure that there's a good fit. I can tell you that marketing health and wellness to a 25-year-old new college graduate who doesn't think that they're ever going to have a health concern in their entire life is significantly different than trying to engage employees who are in their last 5 years of employment and looking to kick back, relax, and spend their time other places than Minnesota winters, right? That messaging has got to be a big part of what you're doing, and so we believe strongly at Worksite Right and here at Northwestern that if we don't understand our employee base, then we're probably just taking a guess as to which services work for us. I want to introduce you to Mary Subkoyak. She's a patient of mine, right? So I was an on-site care provider. I was providing chiropractic care. This was the first company I ever was on-site at. And she's an employee that wasn't coming into my office, right? She never scheduled. She was one of the disengaged workers. Matter of fact, she wasn't a very healthy person. She was in a bad marriage. She used too much alcohol. She was a smoker. She was probably 60 pounds overweight. And maybe her biggest challenge was her mental health status, right? She was depressed. And really without a lot of hope, I would say. And I think that there's an employer too, you know, in some scale of that out at every one of our companies. And when we talk about engaging an employee and making a difference from a bottom line of a company and the impact we have on those that are that come to work for our company each day, Mary's a great example. Because somewhere along the line, because it was easy and convenient and inviting, the messaging happened to be there. She walked into my office one day. And it was like a firestorm of unleashing all of the things I just told you, right? I mean, and she just was hopeless. And through our on-site care program that we had at this company, we were able to get her the resources. As a matter of fact, I think that maybe even more important than getting her the resources, we were able to motivate her to take action in her life to start to make small changes. And it started off with Mary as just taking time over her break to walk around the parking lot at her work. Right? And that's where it started. And pretty soon it was a little bit more. And then she decided she wanted to run a 5K. And in that process, she decided to take on the Stop Smoking program. She shed a few pounds. Through the EAP program, she got counseling with her husband. They were able to work through their issues. It was a pretty dramatic 18 months for Mary. As a matter of fact, 18 months from the first time she walked into my office, she ran a marathon down at Disney for a leukemia patient. And this is a person who, when she walked into my office, couldn't have run to her car. There are employees out there. And Mary's a extreme example of that. I oftentimes say that in all my 25 years, I've met 3 groups of employees at companies. There's a top 10%, give or take a few percentages, depending upon your company, but there's a top 10% that are already doing all the right things. They're taking a healthy lunch and they're part of the gym membership, whether you pay for it or not, they're doing it. They're the people who get good rest and have healthy activities and relationships. And those top 10% are the same 10% that join your wellness committee and that start up your, all of the other activities within your company. And unfortunately, too many companies spend money on that group because they're going to do it as well, right? They give them a gym membership that they were already paying for. And I'm not saying that's not a good thing as an employer to do. I'm just saying it's not the best use of your money. And if you're looking for a return on investment, you better go find a different employee to be able to help out. I think there's also a bottom 10, 12% of employees that I call the Coke, a smoke, and a donut. Right? That's what they do every break. Right? And they ain't going to change no matter what. You could promise them a new car at the end of the year if they quit smoking, and they're still going to go smoke, and they know it causes cancer, and they know it's going to cause emphysema, and they just don't care, and they're not in the right mindset to make a change. Companies spend a lot of money trying to get those people healthy too. Is behavioral change easy or hard? Really hard, right? And so if you're putting all your resources into changing that mindset, I think you're also not going to get the return on investment that you were hoping for. You might get one shining star, but you're not going to get across that mode. What we at Worksite Right talk to our companies about and the employers that we deal with is there's a middle 80% out there, right, who just isn't healthy. It's Mary Subkoyak, right, and a whole lot of other people that are on that spectrum of health that although they could do better, but life's busy, right? I mean, I personally have 6 kids, and when my workday ends, my life gets busier. And so every time I go into my dentist, he's telling me that I'm a month late or 2 months late for my cleaning, right? Life's busy, right? And if that was more convenient, I might engage in that. And so we're going to talk a lot about that early engagement. But that middle 80%, that's the employee group that you've got to understand, right? How do you market to that employee group? How do you provide services to that group that they're going to engage in? How do you not only inform that group, right? How do you motivate that group? And there's a big difference in those 2 words because we're never short of information in our society today, right? Dr. Google can tell me anything I ever want to know more and maybe inaccurately. Information is never the problem. I've never met somebody who smokes who doesn't understand it's not good for their health. They've got the information. They don't have the motivation. And so as a company, what are you doing to provide that motivation, right? To be able to help your employees do that? Because oftentimes what we see is that middle 80%, they just need a little nudge, right? They need a healthcare coach, right? They need somebody to be accountable to. They need somebody to do it with. And when you engage that in that, then they take on the program, and then as a management team, you don't have to spend every moment trying to get people excited about things. Right? Mary's our HR person in charge of HR here, and their team spends a tremendous amount of effort, even at a healthcare university in which we're educating healthcare providers. It still takes a lot of effort to engage people in these things, right? And this is in this environment. What are you doing in your environment? And how can we make that happen? I think it's through finding the right opportunities that match up and are customized to meet the people you have. The great part of the story about Mary isn't that she got healthy, and it isn't that her marriage was restored and all of these types of things. What's really great about Mary is that this just didn't happen to Mary, because along this journey, she took a whole lot of coworkers with her, right? A month after she started walking around the parking lot, I would say there were 50 people. A year from that date, I would say that about 80% of the employees were out on the days like this, using their lunch, the last half of their lunch, to go out and enjoy the sunshine. Right? These are entry-level, production-level employees out walking the parking lot at their company. That's a powerful thing. And that's because of what Mary chose to do. And I think that if we can move that 80%, we can find the Mary Subkoyaks of the world, that makes it all easier. And as a company, we get to get credit for saving money on healthcare. That's a pretty cool thing too for people who are focused on the bottom line, let alone what happens in Mary's life. As Worksite Right, we like to think about employee health or productivity in this light, right? We think that there are a couple different aspects as employers you need to consider on how do we develop that ideal healthy employee, or how do we go hire that ideal healthy employee, and how does that work? And we think that worker selection is really important, right? I mean, it's always great to hire the right person right from the start, but as I said, in today's job market, sometimes that can be challenging. Right? You know, we don't get everything we want. We don't oftentimes we're not looking at 100 applications for a job. And so that is certainly part of it. We think that you need to be proactive in thinking about prevention issues, and that should be a big part of your messaging. As I said, our healthcare, and this is on us as providers, for the last 50 years has said, wait till you get really sick, and then I've got a pill for you to take, or I've got a surgery for you to have, and then we'll just manage your diabetes for the rest of your life. What happens if we go back in time a little bit and catch that pre-diabetic person and instill some healthy habits so that I don't have to take a pharmacological answer for the rest of my life that the employer is going to pay 65% of. I get to enjoy the better health, and everybody reduces the costs that are involved. I think intervention, and when I say intervention as a third aspect of what we do, that's customizing what you need as in your company. Whether it's, like I said, 5 employees, and how can you do that? Because if you have 5 employees, I'm guessing that your employee wellness budget isn't going to be $250,000. If it is, then we for sure want to talk after we're done here. But the reality is that we all have these constraints, and so how can we provide some intervention, and how can we do what's possible now and then build on that program? How can we intervene at the right spot and then see success from there? And then how can we manage it? And that can be the challenge, because companies already have a full slate in trying to get their product or service out the door and being profitable in that light. So how do you manage one extra thing? That's a question we get all the time. When we're out talking to employers about on-site healthcare, they say, oh man, I can't take on one more thing, right? I just can't do it. And the answer to that is that you should be working with the vendors that take those things off the plate, right? Because those employee health issues, they're on your door every day anyways, right? They're costing you money. They're the workplace injury that takes place. They're the person that didn't show up again. It's the 17%, 19%, 21% absentee rate that you're dealing with all the time. You're dealing with those things right now. What happens if we took that absentee rate and drove it down to 2%? Right? What happens if we get this, the company that I was talking with last week, they have a turnover rate, right? 400% in 2018, right? 400%. If they can get an employee to last 6 months, they keep all but 2%. But it's a manufacturing industry, right? So it's manufacturing industry, right? And they build modular homes, right? But can you imagine having to hire? They're a company of about 200. They hired 4 times that in 2018. You want to talk about some administrative costs? You want to talk about those things? That's a challenge, right? So how do we manage this? And working with vendors that have an answer to this, vendors that you talk to shouldn't just have a service, right? It should be a service that provides management, and then most importantly, maybe accountability at the end of the process. Nothing drives me crazier than wellness vendors that are willing to go give a service and they don't have a follow-up tracking measure in place to say, did I do a good job or not? We believe strongly with Worksite Right that we want to create a relationship that we're going to be working with you for years and years, if not decades and decades. And the only way we can do that is if we're accountable back to you, right? We don't have a fee-for-service basis where the more fees we do, the better we get paid, right? What we have is that we've got a performance-based system in play, right? The better we are at keeping your employees healthy, that's how we get paid, and that's how we get contract renewed. And we think that that's a better system. What's our current healthcare system? Fee for service. As a provider, the more services I do, the better I get paid. Has little to do, matter of fact, I might even benefit if there was a bump along the road and my patient needs a few extra services and now I get paid a little bit more. It's crazy, right? I should get paid on performance. If I'm really good at keeping my patients healthy, if I'm really good at motivating them to stay healthy, then you should want to pay me more because that's the ideal person that you need to be coming into your office. Speaking a little bit directly to Worksite Right and what we're doing here, we provide a handful of different services. We provide some consulting work, right? Sitting down with management teams and saying, okay, where are you at? Where do you want to be? What are your challenges? What has worked and what hasn't? And how can we develop a plan, whether there are services or there are other people's services that we think do best practices, and referring you out to that process. So that healthcare consulting is an aspect. I've mentioned to you a lot about the core focus of what we do is providing on-site healthcare, and our ability to deliver healthcare within the workplace does a couple really great things. Number one, it provides that access early on in conditions, right? Our on-site care providers, they don't have people coming in saying, I can't stand up, but I need to be better by the weekend, right? They have people coming in saying, you know what, I slept a little awkward and something isn't right. And it takes very little work to get that employee back to health, as opposed to again, another great example I use is that I remember one time when I was first graduated and I was in a clinical setting and I had an employee come in there having shoulder problem. They couldn't lift his shoulder up any longer. And I said, how long has this been going on? He said, well, I just can't, just the other day I was playing catch with my son and now I can't lift my arm. I said, well, no, how long has the shoulder been giving you a problem? Oh, about a year. Right? But it wasn't bad enough for them to go in, right? It was probably a mild strain of one of the rotator cuff muscles. But guess what happened now? The rotator cuff tore because it hadn't been addressed. Do you realize that that there's been a study done on employees, and over 50% of employees walk into work with an underlying condition that they know about that they're not treating? So think about that. They know they've got a healthcare condition that should be treated, but they're not doing it because it's not bad enough, or they don't have the time, or they don't want to pay the deductible or the copay, which again is a crazy thing to me, right? In healthcare, what we've done, the answer to the high healthcare costs is to share the cost with the individual, right? So we have these higher deductible plans and copay systems and those types of things. Well, what does a high deductible do for an entry-level person at a manufacturing facility? They don't got an extra $1,500, right? So they just aren't going in, right? And so they have to wait until then it's an emergency room visit or it's a workplace injury. Because now if it's a workplace injury, guess what? Somebody else is going to pay for the bill, right? And so it creates this really bad dynamics. But with our on-site health care, we can provide consultation. Nearly half of our interactions with employees aren't even chiropractic care. They're health care consultation. They're triaging them out to the right off-site provider, right? Maybe you need to go see the orthodontist for this, or maybe what you need to do is you need to see the podiatrist for this, or whatever the specialty is out there, right? So it's a triage opportunity. It's an opportunity to engage with a healthcare person in the workplace, and I don't sign your checks, and I don't sign your performance evaluations, and we can have an open conversation about where your health status is, and I can give you feedback that's geared towards you. The great thing for our on-site providers, and the thing that they love in this process, is that they get to walk into an environment and their main focus, their main objective is how can I improve the health and well-being of the person that's in front of me right now. As a healthcare provider, that's why we sat hours upon hours upon hours upon hours in rooms like this, because that's what we wanted to do. We didn't want to be in a system where we got 6 minutes with a patient and 12 minutes documenting that patient, right? That's where we are as a healthcare system. We want all of those minutes devoted to the person. And that's where our programs come in too. They're employer funded, so there's no third-party reimbursement policy with all of that. There's checks and balance systems in play to make sure that our performance numbers are good, and we can provide a return on investment and track that data that makes sense for companies of all sizes. And that's pretty exciting. We think that's part of the passion that I talked about when I started, right? This presentation is that I get to do something I really love to do. It's because I think we can have a difference. I think if we can work with enough employers, right? If we can talk about this type of service, not only us, we're not the only ones that are doing this, are we? Right? I mean, there are others right within our community that are providing this service. We think that this is a great way to be able to impact the healthcare delivery system. We think this is a good way to help employers in our community become more profitable, become stronger, provide jobs within our community, right? And we think it's a great thing for Mary Subkoyak to go home to a happy, healthy house in which she's around raising grandkids and all of these other things. That is a powerful thing. And so we're really excited as a university to be going into this, because the students that are on spring break right now, that sit in this classroom, they want to go out into a better healthcare system. And we think that we need to partner with employers and be able to track that data. We can't talk about theory, right? We can't make promises and wishes and all of those things. We need to track the data, and we need to be able to identify where is it that we can be successful. In addition to the services we provide, we really want to promote this process. And this little diagram is going to look familiar to anybody in business, right? It's always a quality improvement. Everything we do goes around this process, right? We evaluate, right? We strategically plan, we implement, we take a look at the outcomes. We do the same thing with our healthcare programs, right? We want to customize the program to be able to meet what your need is. And in that light, that always starts with the assessment. And this is, again, what I talked about earlier, is if you don't know your employees and you don't know their healthcare interests, their needs, then you're not going to be successful in delivering. When we assess a company, we sit down with management and say, what are your short and long-term goals? What obstacles have you faced in the past that have prevented you from achieving those goals? And then we go out and we talk to the employees to see if that management messaging is getting out to the employees, and oftentimes it isn't, right? Can't imagine how many employees we talk to that don't even know how to go about seeing what their benefit coverage is. Something as simple as that, right? They don't even know what their benefits are. They don't even know, let alone the fact that there is a stop smoking program, or there's a weight management program, or there's a, you know, I can call this helpline, I can get telemedicine. They don't know how to engage any of these things. And that's difficult. So we have to assess the employees, find out what their health status is, and what we need to do to motivate them. We also take a look at the workplace facilities, because sometimes if I've got to sit at a desk, right, for 8 to 10 hours a day, right, that's going to affect my health. We better make sure that the employee understands how to interact with their workplace, whether it's in our offices or whether it's out in our factories. And that's an extremely important piece to employee health. And it sets a good standard. One of the things that's gotten a lot of positive momentum here at Northwestern is we're instilling a sit-stand desk program, and you can't imagine how excited somebody can be about being able to stand while they work, right? I mean, it's crazy, it's fun, right? But what it tells the employee is it tells the employee, hey, I care, right? I mean, they want me to be comfortable while I work, right? They want to support me in these decisions. And so what are your facilities like? And like I said, it doesn't matter if it's your office setting or if it's your factory or if it's your truck drivers as they're heading down the road delivering your products or goods. Right? All of those things need to be evaluated, and we need to try to enhance those the best you can. The last thing we do is that we take a look at the data, right? Because it's always about the data. What do the healthcare claims say? Right? We can get a baseline out there of what injuries, what's the health status, and that allows us to be able to track the program. If we want to be able to reduce the number of low back injuries for a company, right? Well, we better know what the low back injuries history has been, and we better be able to take a look at that claims data as it moves forward to see if we're having an impact. Because if we're not having that impact, then we're not messaging something right, or we haven't identified the correct problems, or whatever the case is. But it's tracking that data that's really important for us to be able to customize a program. Certainly, one of our accounts is in its 4th year. We're coming up to the 4th year, maybe like right next week. And that program is significantly different than the program we implemented, right? When we implemented the program, it was drive down work comp, drive down work comp, drive down work comp. Don't care what else you do, just take care of that problem for me. Now that program is changing and developing because we're solving problems. The next thing is coming along. They're 4 years later, and now what they're trying to do is how do we maximize production, right? Because we're going through a stretch where we're really going to have to ask a lot out of the employees. Well, what happens if you ask an unhealthy worker to improve their production on a daily basis by 10% or 15%? They just don't have the capability, right? What if that same employee was a better weight, a better physical condition, and could handle that physical work, right? What happens if I've got to sit at a desk and I'm 40 pounds overweight, right? And I can't get comfortable, and it's causing circulation issues. As a matter of fact, it's changing my focus by the time I lose my focus by 3 o'clock every day, right? And maybe it's because I've had 4 energy drinks and 6 cigarettes on my break, right? And now my body is nutritionally not in a place to keep that focus. Those are the types of things that we think are important, and the claims data does the management of that for us. I like to put this out because we're chiropractic, and we think we're pretty good at musculoskeletal conditions, and so this is a small little study that was done by a local healthcare group. And what they did is they took a look at 800,000 providers of all different disciplines, right? So chiropractors, physical therapists, MDs, the whole works. They took a look at 800,000 providers delivering 16 million episodes costing $31 billion related to non-surgical spinal care, right? And so they said, okay, we want to find best practices amongst this process. As a matter of fact, the American College of Physicians had put out some guidelines that said this is what they found when they were looking across studies, and so they wanted to know whether those were sufficient or not. And they found out on $31 billion of claims. That's a little study, right? That's a little study, right? It's huge. What they found is that if we're taking a look at non-surgical low back conditions, right, we want to manipulate exercise, educate, massage, acupuncture, yoga, over-the-counter pain medication. Those were the most cost-efficient and effective forms of treatment, no matter which providers you saw. The things that were ineffective, right, opioids, injections, and imaging. We all know about the opioid issue right now, right? The pharmacological answer isn't what it was promised for so long, right? There's challenges in that. Not that it isn't appropriate and necessary at times, but certainly it isn't something that we want to jump into if we don't need to. This is the American Medical Association. So as a chiropractor, makes me stand up a little taller, because it isn't me telling you that what chiropractors do is really effective. It's the medical profession saying what they do is really effective. And I think that this is a powerful statement, especially if we can engage employees or our patients early in care, right? And avoid extremely costly, poor outcomes. And certainly if we can avoid somebody from becoming addicted. Do you know that it takes 3 to 5 days to become addicted to opioids? Should that be concerning to us as a society? Right? I mean, I hardly run into a person anymore that doesn't know somebody or a family that's been affected by that. Right? And it's across all socioeconomical status. It's across all race demographics. It's across everything. Worksite Right, we are proud to say that in our infancy still, right, we're just a few years into this process, and we've been able to secure some accounts and track some data. And one of the things that we get back from our accounts is we are having this effect, right? So we are accountable on the back end, and here's what our accountability says. It says that we can have an impact on healthcare costs, and we can certainly impact the work comp arena in itself. As I mentioned to you earlier, a couple of our accounts, we were out in Indiana a month ago or so, right, Emily? And as we pulled up to this company, right, on their electronic billboard out front, it said, "Now hiring, on-site chiropractor available," right? They are utilizing this as an opportunity, differentiating themselves from other employers in providing a benefit in that way. And whether it's on-site chiropractic or a handful of other things, I think that's a real thing. We know that we're having an impact on company morale and the engagement process for employees, as well as reducing the idea of absenteeism or presenteeism as well. So what are our numbers? I'm going to spend just a couple minutes on our numbers, and I'm going to open it up for questions and answers and/or for you to go enjoy a nice day. But we like these numbers, and I know it's bragging, and I don't care. I mean, this is independently verified data. This isn't us saying this is how good we are. This is us collecting the data that the company has provided and sending it out to a third party, and them saying it's all good, right? And so we'll look at just a couple of the results, and some of this is within the work comp system. But it's across the board, right? So worker compensation total recordables, the number of recordables that took place the year before we started the program was 33. The year after the program is 13, and that's pretty significant for a company of 180 employees. That's impactful. But what's really impactful is that during this time, they had a dramatic increase in the production that they were asking. So they kept the same number of employees, and this is again a manufactured housing company, and instead of making 9 houses a week, they were making 12 houses a week in the year that we were there. And we were able to see a reduction in the number of recordable injuries. So what does that mean to cost? Would this satisfy anybody's return on investment, right? What they were spending, $256, and in the first year of our program, $77,000, right? Do you think that they signed the contract for the next year? Yeah, because we were having an impact. And these are just the dollars, remember. There's a Mary Sipkoyak behind this dollar, right? Who's not just work life got better, but right now she volunteers down reading to kids at the library, right? So when I bring my kids in, there's a Mary Sipkoyak reading there that wasn't going to do that at any point in her life until something changed. And it was the opportunity that her employer provided that got her to be able to do that. We like this one a lot too, not quite as much as this company likes this, but the orange is the first year the year before we started with them. The first year of our program, they spent 156. This is a manufacturing facility of 190, 210. They spent $14,000 within their entire work comp system last year. Was that all us? No, but was it because we're changing the mindset of the employees, right? And they're a happier, healthier, safer person? We think that that's pretty impactful as well. Here's another one that just talks about the average case condition, right? Before they started with us, they were spending $6,300 for every case, and the $3,000 that they're spending in the first year of our program. Why do you think we saw a reduction in the cost per case? I'll tell you why I think. I think it's because we were engaging the person earlier in the healthcare condition, right? We didn't wait for that person to get really, really bad, right? Most employees, contrary to a lot of belief, most employees don't want to file work comp and don't want to deal with the hassle and don't want to, there's bad apples out there and there's abusers, and those are the ones we remember, but the average employee just wants to go to work, get paid, and not cause problems. And when you have that mentality, they let things go too long, and now all of a sudden that low back strain has now turned into a disc injury, right? And now we're in trouble, right? Or that type of thing. So we think we engaged them earlier in the process. We also think we were able to elevate the health and well-being of the employees so that when they took that slip off of that ladder, right, or they twisted their ankle walking through the office, that they were able to recover quicker because they were a healthier person, right? They had lost some weight or whatever the case had been, and so we think that drives the process as well. This maybe is the number I'm most proud about, and the number I talk to my team here about as vital for what we do. 7 out of 10 employees on site at our facilities seek out this program, right? And to get 7 out of 10 employees at a company to do anything is amazing. And so I think our participation rate is so valuable to the outcomes that are happening. What this tells me is that 7 out of 10 employees is participating, at least in some level, in improving their health. They have engaged that. They've thought enough. They've taken the energy to go up and have a question taken care of. They've gone up to our healthcare provider and said, hey, you need to come back to my workstation because something's not right. Every time that I'm on the phone for a little bit, I get this cramping in my shoulder and I need to know why. Right? They've done enough to say, hey, I've got something that needs to be taken care of and I'm going to take care of it through this program. 7 out of 10 employees are participating in their health care, and that's a whole lot better than most of society. Right? And it isn't all us. It's working with employers like you to be able to develop programs and services that meet your needs, because everybody's got different short-term and long-term goals. But we're pretty excited about the process that we have, and we're pretty excited about the outcomes that we get. We're excited that we've been able to extend every contract that we've engaged in, and we think it's because we take an approach to employers exactly the same way we were taught in becoming healthcare providers. When I was taught to engage a patient, I was told that the first and really valuable thing is to take a history and do an exam. And if I do a really good history and a really good exam, I was a lot more likely to put together a treatment plan that was going to be effective. And then if I could engage my patient in that treatment plan and get them committed to that treatment plan, the outcomes were probably going to be pretty successful. That same process happens with Worksite Right and employers. We sit down with employers and we take your history. Right? We want to know about what's happened in the past and where you want to be in the future, and then we do an exam by taking a look at claims data in your facility and talking with your employees so that we really understand it, so that when we strategically plan a program for you, we can say with a lot of likelihood that here's a program that we think is going to be effective. And we're going to watch that program along the way, just like we do follow-up exams in healthcare. And if we're not meeting our goals, we've got to figure out why, and we either have to refer somewhere else, bring in another resource, or whatever it is, but we can track that program along the way. We think that that's a model that has a lot of opportunity for success at a lot of companies. We'll end with this, is that, just a couple questions that I hope are running through your head at this point. What I really hope is, you're thinking about that Mary Subkoyak that's out there, right? And what little bit of motivation can you help that employee, and they can become a star employee. See, when Mary Subkoyak walked into my office, right, she was a line production person, right? And over the next 18 months and 24 months and over the next 3 to 5 years, now she's a department supervisor, right? She would have never been that department supervisor if she wouldn't have made those changes in her life early. And I don't talk about Mary because I think I did anything great. I did the same thing for Mary as I do for all the rest of my patients, right? We engaged an employee that was willing to make a difference. We provided an opportunity that allowed them to reach their potential. As employers, I think that that's what our goal is across no matter what platform we're talking, right? Whether our salespeople and how can we assist them in becoming the best salespeople? Our quality control people, how can we assist them in becoming the best quality control people? I think it's the same thing in healthcare. How can we maximize that? Because if I have a healthy, happy worker, they're a better salesperson, right? They're a better program manager, right? They're a better quality expert. All of those things have a dramatic impact on the profitability of our company moving forward. I want to thank you again. As Mike mentioned earlier, this is a beautiful day, and it takes a bit of energy to get yourself here and to be involved. I really hope that you've had an opportunity to see things through our lens a little bit here. We are pretty proud of the university and what we do. We've got 1,000 students that come into these doors, not during spring break, they're off somewhere else, but we're pretty excited about creating a healthcare provider with a lot of the messaging that I've talked about here today, a lot of the accountability of that aspect, and certainly we welcome you back. Feel free to be in touch with us. We'd love to show you around our fine facility or those things, or certainly as Worksite Right, we would love to engage you in a conversation over your employees' health. And so certainly we'll make ourselves available. It's 12:30, and I think we were scheduled till 1, which gets you back to your office early, or certainly I'll be around to answer or address questions or have conversations. I think that this is exciting. And I oftentimes have brought back to a conversation I had with the owner of a company when I was just into employee health. And it was a family-owned, it was a 4th-generation family-owned company. And Carl came to me one day, and as this program was going, and as a 4th-generation owner of a company, you care about everybody, right? I mean, this was a guy who started off as a 14-year-old kid sweeping the shop floor and worked his way up. And he walked into my office, and you don't get this opportunity very often in this world, but I could see that he was emotionally moved. And what he said is, Chad, he said, I just had an employee come into my office and said this is the greatest thing that's ever happened to them in their 33 years here at Plato Woodwork. That is an impactful thing, right? You want to make a difference like that, right? That employee now is bought in. That employee is going to attract other good employees, right? And I think that from our standpoint of Northwestern and Worksite Right, to play a role in that is a pretty fun thing, and we welcome you to join in that journey too. So, thanks for coming, everybody.